And I wanted to ask the Prime Minister a question about the rate at which Health Canada is providing approvals to companies who are looking to offer new testing kits. As provinces start to unveil plans to ease health restrictions, one of the key factors in allowing them to do so will be the ability to ramp up testing efforts. Once again, we see an example of government reacting very, very slowly and can't keep up with entrepreneurs and with the private sector. And as latest information indicates that up to 50 companies are waiting for Health Canada approvals. So can the Prime Minister explain why Health Canada has to this point been unable to implement a fast track process so that provinces can get the new testing kits that they so desperately need?
Thank you, Mr. Speaker. Thank you for your question. It is really important that we get testing up to speed, that we make sure that we have reliable testing across the country, because that is an essential part of restoring some semblance of normality as we move forward, as we look to reopening. But at the same time, we've seen around the world problems with test kits that have been faulty or unreliable. And one of the huge challenges we might face if tests are unreliable is we could have an undetected resurgence of COVID-19. We are incredibly pleased by how many innovative Canadian companies and individuals have put forward new solutions, and Health Canada is prioritizing and rapidly going through a process of evaluating these tests. But at the same time, we cannot compromise on not just the safety of individual Canadians through this test, but the safety of our entire country. We have approved a number of different tests. We will be approving more, but it needs to be done in a safe way with the real recovery of our country as the core goal that we're facing.
Mr. Scheer.
Mr. Speaker, information has come out that a Canadian company called Blue Dot was able to track incidents of COVID-19 in China as early as December of 2019. Blue Dot has indicated that among their clients are 12 countries, including frontline healthcare providers here in Canada. Can the Prime Minister indicate whether or not the Government of Canada had access to Blue Dot's information back in December?
Mr. Prime Minister.
Thank you, Mr. Speaker. We were advised in early January of the possibility of what became COVID-19 in China. We made sure that we were monitoring intelligence sources, working with our Five Eyes partners on that. As you highlight, a Canadian company was involved in tracking the spread early on. But we are glad to have that company with us now. Our information around what was going on in China came to us through a range of intelligence services, public accounting and reporting, as well as our Five Eyes and other allies around the world. We continue to work with all those allies to understand exactly what's going on around the world and how we can best position ourselves. We are working with a range of technology companies and innovators to ensure that we're actually doing everything we can to monitor and track the spread of COVID-19 in Canada. There's lots more to do, but Canadian innovation will certainly be a part of that as we move forward.
Just to pick up, Mr. Scheer, you have about a minute left, so 30 seconds for a question, 30 seconds for an answer. Mr. Scheer.
So a very quick question then. In that answer, the Prime Minister indicated that they had received information in January from a variety of sources. One of those sources of information was the Canadian military intelligence experts who warned that this disease was going to be more serious than the WHO had originally indicated. So we've asked this question several times before. It's a simple yes or no question. Did the Prime Minister see, did Cabinet, anyone in Cabinet, or did the Prime Minister see the Canadian military intelligence report that was issued in January?
The Right Honourable Prime Minister.
The Public Health Officer of Canada convened a conversation with her provincial counterparts as of January 2nd to address reports of of a virus or a particularly bad strain of influenza that was occurring in China. We got regular updates from our intelligence officials. I cannot share specific briefings with you here, obviously, but I can assure you that our intelligence agents and officials were very active in keeping Cabinet and the government apprised of latest developments.